This is San Diego's news channel, KUSI News.
Welcome back to Good Morning San Diego. A San Diego surgeon has developed a technique that is helping paralyzed people walk again. Joining us this morning is UCSD neurosurgeon Dr. Justin Brown. Good morning, doctor. Thanks for being here.
Good morning. Thanks for having me.
Okay, so walk us through this. There is a new study that was published last Thursday from UCLA that's got some promising new information out for people dealing with paralysis, but you are already working on that and have a technique that may help folks.
Well, the study that just came out is actually very promising, and what's different this study compared to previous studies is it's talking about using what's already there in the spinal cord. I think that's not very far off before we'll be able to implement that in patients.
Okay.
But what we have is, today is useful, are things that we can do right now, which is moving nerves that already work to a muscle that doesn't work.
Okay, so you have a technique that, and you're one of the only people in the world that's actually doing this particular surgery.
There are probably a handful of us now.
Okay, you're an elite few. Don't be so modest over here. Walk us through some of these pictures that you've sent us and tell us exactly how this works.
Okay, so this is a patient who was shot in the upper arm and he lost his radial nerve. And unfortunately, losing the radial nerve makes that hand completely useless. And you can see in that picture, I'm asking him to make a fist or lift his wrist up, and he's completely unable to do so. And so what we've done for him is, because the injury was so high and so much of the nerve was damaged, we actually rewired him. And what you can see in this picture, I wish in the patients the nerves were colored like this, but we took a little bit of the nerves that actually flex the fingers and flex the wrist, and we rewired them to the nerves that extend the fingers and extend the wrist. And then we have a video in a moment that'll show you what that does.
Okay, and so basically you're taking what's already in there and rewiring it so that the patient can learn to use it again properly?
That's exactly right.
Okay, and how are you working with this patient?
So here he is afterwards. So he has nerves that normally would flex the fingers and flex the wrist, and now they are extending the wrist, extending the fingers individually. And so he has all kind of control that's recovered from nerves that don't normally do any of these functions.
How long does a process like this take from a patient who can't move their hand, like in the first picture we saw, to that, where they're pointing, they're making a fist, they have full or most movement again?
Sure. With nerves, they regrow relatively slowly. So it's usually, we quote patients about 1 millimeter a day. And so from the region that we repair to the muscle, those axons are growing to 1 millimeter a day. So usually 3 or 4 months for something like this before we see the first twitch, and usually a full year before he looks as good as he did in that picture.
How long have you been working on this technique?
I have been doing this for 5 years now. Okay,
and so are more and more patients coming to you and hoping to get movement in other places besides just their hands, or is it maybe like a leg? Are they able to walk again?
Absolutely. Well, what's different now is we're beginning to apply this to things other than nerve injury. We're applying it to spinal cord injury. So these are areas where people never consider using a nerve intervention to make something work. But you can imagine, if you, that black and white picture we had there a minute ago, if you can take a nerve that you have control of and you move it to a muscle below the injury that you don't have control of, there's the picture right there. So you have an injury in the middle. Above you have the stuff that you can control, and way down below you have the stuff that's paralyzed because the brain can't talk to that part of the spinal cord. We can now rewire from above that to down below that and get that muscle moving again.
I mean, this is huge. This is life-changing for so many people who've been in accidents or for some reason are paralyzed.
It is a big deal, and you can see there's another picture you had up there just a second ago. You can see the trade-off is not too bad. Here's one, a patient, a lot of these high spinal cord injuries, their deltoids work, their biceps work, and nothing in the hand. And we can take just a little bit of that elbow flexing muscle and move it in there and get their fingers to flex. We can take another one and get their fingers to open and get their arm to extend. So we can really recover several levels of function in a patient who's been paralyzed.
And that has got to be the best news for someone who heard after an accident you'll never walk again or you'll never move your hands again. And then they can just a few months later.
Very exciting for the doctor as well.
Wonderful. Doctor, thank you so much for stopping by this morning. I appreciate your time today.
Thanks for having me.
Take care.